Mac McMillan. Thank you so much for joining me.
Yeah.
You've seen so much, Mac. You've accomplished so much in the health sector security space. You could be doing anything you want, Mac. You could be on the ranch full time. You could be spending time with your grandkids. You could be retired on a beach somewhere. Yet here you are, and I'm grateful for it. But what has motivated you, Mac, to join the First Health board?
Well, I think Carter, I think there's probably three reasons. The first one is you, and I'm not to blow smoke up your skirt or flatter you, but you and I've known each other for almost a decade now, and we've talked on and off throughout the years, and you have always impressed me as someone that I think actually gets the mission. And what I mean by that is, when we created CynergisTek many years ago, we created it to support the mission of healthcare, not the mission of cyber, right? And I think that's the difference. I think there's a difference in terms of how you define what you do, right? You may be a cyber company, which we were. You may be an accounting firm. You may be a firm that creates, hand towels or scrubs. But the mission that you support is the mission of healthcare. And I think that's the difference. And that's what I see, or what I have seen in you. And that's the one thing that I've been very, very impressed with. So I'm always willing to help folks that I think get it. And I think understand the mission, number one. Number two, I love this industry, and I love what I've done for the last, 40 some odd years, and thank God I'm not dead yet. So I still like sharing and being on advisory boards and being able to help folks who are still trying to get the job done and do it right, and being able to contribute and helping them to do a better job is something that I think is very, very rewarding. And so I enjoy doing it. I enjoy being involved in the dialogue and being able to still contribute. Don't get me wrong. I love my ranch and I love my animals, and obviously that's where I spend 90% of my time, and will continue to. But the little bit of time that I spend with you and with other folks that I advise, I try to find folks that I think are trying to do the right things, and that if I can contribute in some way, it makes me feel better, and I enjoy doing it. And then the third reason is, I know you haven't, we're not going to talk about it, all of them on this call, but you've put together quite a board, an advisory board. It's a lot of folks that I've known for years in the industry and think very highly of. And I enjoy just being in the discussion with those folks because they're very smart people. And I've often said, the way you get ahead is you surround yourself by folks smarter than you. And I think you've done a good job of that. I think you've brought in a lot of talent and a lot of experience. And frankly, some folks that have dedicated just as I have and you have many years of their life to this calling. And it's going to be exciting, I think, to see what you do with this board. And I think you have a real opportunity, and I think if you use it right, I think at least the other guys are going to be able to create for you a lot of value. And we'll see what this guy does, but I think the rest of them will definitely be very valuable to you.
No doubt. And thank you for those kind words, Mac. And I can tell you unequivocally, the industry is better off if you're active and still engaged. And you mentioned over the course of 40 years, you've seen quite a bit. And in 2024, there's a lot of change in the air when you think of what the SEC is doing, what FTC is doing, what we anticipate from a cyber performance goals perspective out of Health and Human Services. Do you think that these moves are going to make a real impact in 2024 and change the culture and the mindset of the healthcare community as it relates to security and privacy?
Well, I hate to use this word because hope's not a strategy. Certainly not an operational plan. I'm very hopeful that it will. Right, I'm very hopeful that at some point we're going to hit an inflection point in this industry where the light comes on and everybody realizes that you know, if we really want to get ahead of this challenge and really be effective at protecting our systems and our data and our patients, et cetera, we're going to have to make some serious commitments. We're going to have to make some serious investments, and we're going to have to work together. And I think that's one of the big things. One of the things that concerns me about what's going on with the government is, and you've mentioned in your question 2 or 3 different departments out there that are doing things. The problem is, as I see it, is that I think we need an overarching strategy that coordinates all of those efforts, so that we have a consistent approach, so that one organization isn't going this way and one's going that way and one's going this way. I think we need to be very honest with ourselves as an industry and recognize that that this is not going to go away, that this is an everyday threat, that this is an everyday part of our business, that cybersecurity is, whether you like the term or not, it's a cost of doing business. I mean, you're going to have to address it. If we want to be the IT enabled industry that we are already. And I think people have to understand what that commitment is. And I think we need to finally have an awakening with respect to what it's going to take to get that done. I see all these different incentives and all these different approaches, and I'm kind of an old-fashioned guy that believes in accountability over incentive. I don't have a problem with incentives, but I think incentives ought to be focused on performance, meaning you do a good job, you do the things that you should be doing, or that make sense, that are meaningful. Then incentivize that behavior. But at the same time, you don't excuse the opposite. Right? That there ought to also be the accountability for those that fail to do those things. And to me, that's just a responsible way to do business. Whether your business is providing care or providing financial services or whatever it is, your customers, whether it's a patient or somebody or a depositor, they're expecting that you are going to be responsible as somebody who is serving them. And I think that's really what it comes down to. And I'm hopeful. I don't think that in many ways, I don't know that we've gone far enough yet still. And I still hear these discussions around, let's update HIPAA. I think the only update HIPAA needs is putting it in the trash can. And I mean, it was antiquated 5 years after it was written, 20 years after it's been in existence. It is for sure not relevant. And we need to understand that, and we need to just say that, rip the Band-Aid off, and say this just isn't a relevant way to measure doing a good job around cyber in this industry. And I think a lot of people are still very reluctant to do that. I still think people are very, it's really interesting too, when there was a dialogue, as not too long ago, where we were discussing, where somebody made the comment, we paid enough. My response to that is, you haven't paid enough until you've solved the problem. I mean, whatever it takes to get it done, that's what it takes. And interestingly enough, the Carter, and this, the bad guys, you did a podcast not too long ago called "The Threat Never Sleeps." I mean, they're not going to give you a break. just because you're a healthcare entity. They're not, they're not gonna give you, any leeway. And we've already seen that. I don't know how long it's going to take for people to really actually, incorporate that into their reality and understand that the bad guys are there. They're going to do what they do, and you have one of two options. Address it and be better at defending yourself, or be a victim. And and my position is, if you choose to purposely be a victim, then you should be held accountable for that. But if you've done everything, but if you purposely decide to try not to be, and to do the right thing, to take care of your patients, then the rest of us ought to be getting behind you and helping you and incentivizing that kind of behavior as the thing that we want to see. So, the good news is, you've got a lot of smart people on this advisory board that have experience from all facets of healthcare as it relates to this issue, whether it's policy, whether it's leadership, et cetera, et cetera. And I think you've been very, very, very good at being very vocal and very supportive of a lot of these efforts already on your own. And I think this is just going to give you a platform and a vehicle to help you be an even bigger voice in the industry with respect to the things that we really need to do. And I think that's, like I said, I think you've got a great year ahead of you.
Well stated, and I agree wholeheartedly with your views on accountability and the understanding that security is going to be just a cost of doing business, or as I have often said, a business imperative, but also even in some ways a moral imperative to protect the communities and the patients that you serve. And I'm also optimistic that HHS at least, is informed enough to begin coordinating, to use your word, bringing together all the resources and agencies that have been so sort of disparate in what they're doing. And this is what I think we're going to see here soon with the health and public health cybersecurity gateway. But I am optimistic there in 2024 that we'll see some of that coordination that we've been yearning for as a sector. And I can say unequivocally, Mac, that as I speak for all of us in the industry, that we're grateful for your contributions over the past 40 years, and just excited you're still here and interested in lending your voice as well. Thank you so much.
Thank you, Carter. Looking forward to it.